So we'll look at some scales and calculating systems, and these systems are basically systems that we use to determine if somebody has a possibility of having fractures in, let me say, the next 1 year, 2 years, and the rest of it. So because they serve the same purpose, we are looking at them in the same video. Do you understand? Not that they are the same, just that all of them is towards trying to dictate if there's any possibility of fractures. So look at the Trabecular Bone Score. We look at the FRAX, which is a fracture risk assessment tool. We'll look at the QFracture. We'll look at the Garvan fracture risk calculator. So how many of them? 1, 2, 3, 4. So let's go one by one. So the Trabecular Bone Score, this is it. TBS. You can pause to observe any write-up here because this is the same thing I'm going to discuss. So it's actually software derived measure from the lumbar bone DXA scans. Okay, so this one is basically trying to evaluate bone microarchitecture. You're trying to look at the bone, the breakdown of the bone. What's the mineral component? How much calcium? Do you understand? Is left and all of that. Is the bone still thick or is it weak? You know. So it provides insight into bone quality. It complements the bone mineral density. So strength is actually an independent predictor of the fracture risk, and sometimes you can combine it with other of these FRAX and the rest of it. So let's quickly go to discussing FRAX. So is this FRAX or is this QFracture? I think this is QFracture. This should be FRAX, right? So FRAX, you said that it was developed by World Health Organization, and FRAX will basically estimate a 10-year probability of hip and some other places that would mostly be affected by osteoporosis. That's if you have osteoporosis. So they're trying to estimate if there's a possibility of you having fractures at any of these regions within a short while. So what's the use? It looks at your age, it looks at your sex, it looks at your body mass index, it looks at if you have ever had any fractures before. So the patient too has to answer these questions. It looks at our family history, have other people been suffering from similar condition as you. It looks at if you have been smoking, if you have been taking alcohol, if you have been using glucocorticoids, if you have had rheumatoid arthritis in your lifetime. Do you understand? And the femoral neck, they'll now do a test to look at what the thickness of your femur. Okay, so strength is widely validated internationally, so a lot of people use it online. Okay, so for the type of patient I can use this for, it's only patient between 40 to 90 years. So that's what we got. Then QFracture, this is QFracture. You can pause to look at it. So you can see that QFracture 2 is a questionnaire where the patient has to answer all these questions. Please pause to observe it. Okay, so what is the summary of QFracture? It's actually a UK based calculator. This one to estimate a 10-year risk of you having fractures. So you mostly look at the hip and other places that could easily fracture, okay, depending on the patient. So what are the things that QFracture looks at? That's all these questionnaires, a lot of questions, but I'm just trying to summarize. So you consider the broader range of clinical factors. So it's looking at if you have some other underlying disease conditions that will further make it easier for the osteoporosis to progress. Do you understand? So it's looking at if you have diabetes, if you have dementia, if you have heart disease, if you have chronic obstructive pulmonary disease, if you have kidney disease, if you have liver disease. Do you understand? And QFracture will also look at if you are taking some drugs, because some drugs, the side effects is they could probably make your bones weak, you know, like antidepressants, anticonvulsants, steroids. And they also look at your history. Have you been falling of recent? You know, so it's very comprehensive. Includes 4 risks, and it looks at a lot of disease conditions that could have actually made it easier for the osteoporosis to progress. Do you understand? So we say that it's actually very comprehensive. So it's very much more in use in the UKs. You know. Okay. So this is a QFracture. Note this. Note the questions. Now we're going to the last, which is the Garvan fracture risk calculator. This one. Okay. So this is a FRAX. This is the Garvan. So if you didn't get the FRAX that time, you could actually get the FRAX here. So Garvan is developed in Australia, and this one is looking at the possibility of you having fractures in the next 5 to 10 years. So Garvan looks at many factors, like your age, like your sex, your body mass index, if you have had fractures before, if you have fallen in the past, you know. So it looks at a lot of history, where you have walked, you know, if you have fell before. So it's also comprehensive, but it's less widely used. It's mostly used only in Australia. Okay, so of course, if you are going to practice in Australia, then you have to actually know it very well.